Good afternoon all. Today's our topic is National Mental Health Program. What is a National Mental Health Program? National Mental Health Program is one of the most prominent measure taken by a nation primarily for the control of both communicable and non-communicable diseases regarding mental, neurological and substance use disorders are a broad domain included under the NCDS launch in August 1982 for the purpose of means to recover the mentally ill patients whoever the persons who means facing the mental issues means whoever facing the psychiatric issues they have to treated they have to treat it they have a right to means to achieve a treatment to for that purpose means for that only means for that things the government has launched national health program on 1982. So there are these are the disorders which currently address least in terms of community attention, identification and treatment, which proportionally reflects as large mental health gap. In India is one of the major countries to adopt a national mental health program for mental health at the national level after the meeting of WHO Mental Health Advisory Group. The National Mental Health Program was implemented all over the country in a phased manner. Then next we have to see what are the objectives of National Mental Health Program. National Mental Health Program was launched with the stated objective. These are the to ensure the availability and accessibility of mental health care for all in the foreseeable future, particularly to the most vulnerable and underprivileged section of the population. Then encourage the application of mental health knowledge in general health care and social development. Third one is promote community participation in mental health services development and stimulate effort towards self-help in community. It main objectives of that national mental health program, these are the three main objectives. Means we have to encourage and we have to apply that mental health knowledge in general health care and social for the social development. It is used means this program is most means foreseeable use for particularly to the most vulnerable and underprivileged section, because that people doesn't know the importance of that mental health. They don't know what is the mental health disorder. That's why there is a important need in that rural area. Main things in rural area what happens, they did not get an idea about that what are the mental disorders, what are the psychiatric disorders. For them the national mental health program was most important thing. Then what are the strategies of national mental health program? First, integration of mental health with primary health care through the National Mental Health Program. Provision of tertiary care institution for treatment of mental disorder. Eradicate and stop the stigmatization of mentally ill patients and protecting their rights through regulatory institutions like the Central Mental Health Authority CMHA and State Mental Health Authority SMHA. There are some limitations of National Mental Health Program, that is lack of steady administrative structure and lack of adequate funding, lack of periodical introspection, supervision, reporting and mentoring, which lead the way for initiative to slowly die over a time, resulting in poor timely delivery of services. The program gives more emphasis on curative components rather than promotive and preventive aspects. Most importantly, lack of manpower resources, because what we see in rural area, there is means many not only ASHA workers or ANM staff that doing that work properly, or that means they have so much work surveys there than other activities they have. So most importantly, lack of manpower resources in it is a one of biggest limitation of national mental health program. Then next one is district mental health program. What is a district mental health program? It is to overcome this limitation of national mental health program. An initiative was taken where the district was considered to be the administrative and implementation unit of this program. Means through means not only one country one program we will implement it. So for that purpose every district take a initiative for applying for implementing this program. Second, the district mental health program has been in existence since 2003. It was launched in 2003 and provides a basic mental health care services for a range of facility and community based, whatever the rural based intervention they want, they have to provide that. Then to assess the feasibility of district mental health program, National Institute of Mental Health and Neuroscience (NIMHANS) undertook a pilot project 1985 to 1990 at the Bellary district of Karnataka. Till now, DMHP have been implemented in 655 out of 724 districts in India. Out of this, 550 districts have operational DMHP. It was components of DMHP in that service provision, management of cases of mental disorders and counseling at different level of district healthcare delivery system, capacity building, manpower training and development for prevention, early identification and management of mental disorders, awareness generation through information, education, communication, IEC activities. These are the important components of district mental health program. Then objectives of district mental health programs are to provide sustainable basic mental health services to the community and rural peoples. Then early detection and firstly we have to detect early what are the symptoms in community based people. Then according to that we have to start treatment in community itself to ensure ease of caregivers, to take pressure of mental hospitals, then to reduce stigma, to rehabilitate patient within the community, to detect as well as manage and refer cases of epilepsy. Which are the services provided under DMHP are clinical services including the outreach services, training all the ground level workers, means Anganwadi workers, ASHA workers, ANMs. They have to train at ground level for identify and referring patient with mental illness, training of all the medical officers to identify and start first line treatment for mentally ill, IEC activities, information, education and communicational activities through online, through telecommunication, through teleconferencing. They have to identify or they referring treatment from that way to the patient. Targeted interventions are being focused on life skills, education and counseling in schools, colleges, counseling services, workplaces, stress management and suicide prevention services they have to provide. Then concert for referral and liaison between PHC, MOs and DMHP in district mental health program. First, identification and initiation of treatment at PHC level using CSP. They have to do follow up and monitoring of side effects. When difficult to diagnose cases and also while spotting serious side effects, what to do? They have to do tele-based discussion with DMHP psychiatrists by MOs, referral to THCs on specific weekdays to follow up with DMHP team, can be directly referred to district hospital, medical college hospital for IP care expert opinion. After that, patient can be followed by frontline worker, care at doorstep by DMHP team, conducting mental health awareness program HWC in liaison with DMHP, training the frontline workers on mental health care in liaison with DMHP. So now today we have discussed about National Mental Health Program, its evaluation, objective of NMHP, various approaches to achieve the objective of NMHP. Then we have discussed about DMHP, District Mental Health Program, its components, and finally the role of nurse in the implementation of National Mental Health Program. This is the bibliography which are I took that content from that books or sites. Thank you.